Коли почалася війна, ми прокинулися у 4:45 від вибухів і сирен.
И не было доступа ни к нормальному, ни к пище, ни к воде.
Я, честно говоря, 5 дней прожила в метро и не смогла там дольше оставаться, поэтому уехала.
Пили воду с отопления, талую воду, слава Богу.
Right now, main things, they're so scared for the future. The IDP patient, they don't even know where to go and when is the war will end.
Samaritan's Purse has come to Ukraine to assist those who are in war-afflicted areas, as well as those who have been internally displaced and have fled to some of the safer areas. So here in central Ukraine, we are providing direct clinical services to IDPs, that's internally displaced persons, as well as the population that's here. The ability for patients, whomever they are, to go to their regular doctor or even go to the hospital has been disrupted because of the war. There's either lack of supplies, lack of providers, or just lack of capacity. And so we're here supporting Ukraine through direct clinical services to get medical care to those who need it most.
The needs that we're seeing so far are patients that have fled their home environment and they've run off without anything, so they don't have their medications, and many times don't even have very many belongings. And they're at the point now to where any medicines that they did pack have been depleted and they're needing a resupply of their medicines or just basic health care.
So today we had a family from Mariupol that came in, a family of 4, had a 2-year-old, a 15-year-old, a husband and wife, and their evacuation story was very dramatic. The dad breaks down and cries because all they had was a car and some basic belongings they had and had great needs. Older child, very afflicted with, post-traumatic stress symptoms, and the day before they left, the mom was working in the theater that got bombed the very next day. As they were leaving, they made it through a Russian checkpoint where they just kind of waved them through, and then they shot up the next 4 cars that were right behind them at that checkpoint.
The psychosocial state of the patients is one of despair, and also anyone that has been through trauma, just sorrow, every emotion you can imagine. These people have been traumatized with the war, and so that emotional and trauma care need is immense, and every single patient has that need.
These stories are hard, finding that place of having an empathetic ear and really being able to sit with people as they've witnessed death and destruction and loss, being able to sit and mourn with them and pray with them and let them talk about their story and be able to process it. We have to believe that He's good, that He has power to save, that it's okay to sit in the brokenness and just hear the brokenness and not always bring an answer, but just point people towards the hope that we have in Jesus.
I think it's hard for anybody to see what they've seen and been through what they've been. I mean, you can see that they're all struggling probably with their own personal faith as well as just trying to see where God is in this. We're strongly connecting them to our pastoral care and pastoral services.
We're here to care for people. We're here to love them through direct clinical care, through provision of food, through provision of non-food items. People are either stuck in their cities, stuck in their homes, stuck in basements, or they're fleeing out and they're looking for someone to care for them. And we have the opportunity of Samaritan's Purse to show them Jesus' love, and we are so blessed to be able to give this directly to those who are most in need.